shots of what it looks like inside the building as well. So thank you very much.
Absolutely.
And now,
thank you for having us.
I appreciate that. Thank you. And now we're going to be switching over to Ms. Dr. Tomaselli Brock, where we're going to be talking about the Physical Therapy Assistant Program that we have at EPCC. So Dr. Brock, whenever you're ready.
Yes, hi. Can you see my screen?
Yes, we sure can.
Okay. So I'm Dr. Debbie Tomaselli Brock, and I've been with the college since 1990 when I opened up the program. And I got into physical therapy because I saw a picture that's very similar to the one that you see on the screen. It was very inspirational to me. It was a child walking down the parallel bars, and there was a therapist behind that child, helping that child learn to walk. Now you're looking at newer technology. This is a suspended ambulation device over a treadmill. So the program has graduated 300 roughly students in the past 30 years. This coming year, we will be next year, 2022, we will be celebrating our 30th year, and that's very exciting. We currently have 3 full-time faculty, and the program has been accredited from the beginning. I don't know if you know this, but there's 27 programs in Texas for physical therapist assistant, and there are 2 programs that are in El Paso, but we are the only community college for about 200 miles. The program itself is a 5-semester program, and it starts in the fall after a specialized admissions procedure that culminates in June. The 5 semesters is a full-time program with roughly 40 hours in class and then another 20 hours of homework at night. So it is a very intensive program. We take 12 students a year. We would love to expand because we have more students that qualify than can physically get into the program because of our space limitations. So hopefully someday we'll be able to do that. With a 40-hour intensive 5-semester-long program, included in that is 720 hours of clinical experience that occurs in a variety of clinical settings, including hospitals and nursing homes, pediatric clinics, schools, private practice physical therapy clinics. So there is a wide variety of exposure that our students get to the various practice settings that physical therapist assistants can work in. In addition, our curriculum has built into it a collaborative bridge to the UTMB physical therapy program. Not all students can qualify, but our capstone course is designed to increase the chances of our students being able to meet the required benchmarks to be able to participate in that bridge. The bridge has only been available for a couple of years, and we currently have 2 students who are in the application process, one of which I recently heard had been accepted into the bridge. The nice thing about this bridge is that it is a guaranteed spot for one of our graduates to go into the UTMB PT program if they qualify for the requirements for the bridge. We might be wondering what kind of jobs physical therapy has. Well, there are a physical therapist and a physical therapist assistant. And so the physical therapist is a person that works with patients just like PTAs do. The biggest difference between the PT and the PTA is that the physical therapist does the evaluations and writes the treatment plan. And the physical therapist assistant carries out that treatment plan. There is a large difference between the 2 educational programs as well. Physical therapists are doctorally trained therapist, and the physical therapist assistant receives an associate degree. So the jobs, though, that PTs and PTAs have are very common. We all work, as I started to mention, in hospitals, physical therapy clinics, nursing homes, skilled nursing facilities, which are not necessarily nursing homes, school districts. But besides the work settings, there are also pathways of jobs that both categories of therapists might want to consider. For example, there is the pathway of clinical management. So clinical management means that you are typically working in a healthcare providing setting, such as a hospital or physical therapy clinic, but you're responsible for the clinical aspects of healthcare delivery, and you're supervising staff who are the clinicians. Then there is the rehab manager. So a rehab manager tends to work more in nursing homes or SNF units, sometimes home health agencies, and this, again, is a management level position, may do clinical work, but also oversees staff in terms of making sure that there's sufficient productivity for reimbursement, that the services that are being provided provide the depth and breadth of what physical therapy can do. Both PTs and PTAs can own physical therapy clinics. Another job area would be a consultant. A consultant can work for places like insurance companies, reviewing documentation to make sure that that documentation meets the criteria of the insurance carrier for reimbursement. Or they can work in military institutions as public employees. I have a couple of grads who have worked at Fort Bliss as an example. Then there are lots of special needs organizations out there for autism, for cerebral palsy, for stroke, and those agencies also provide consultative types of therapists, PTs and PTAs. And then there's education. So I'm the program director for this program, and so a PTA can be the program director as long as they have a master's degree. Let's see, and so I wanted to give you a couple of statistics about physical therapy in general. There are 7,550 physical therapist assistants in Texas. Now you might be wondering why I am emphasizing the word assistant in physical therapist assistant. And that is because a physical therapist assistant is a person who has received an associate's degree from an accredited physical therapist assistant program. A physical therapy assistant or a physical therapy aide is just that. They're both aides. So it is important to make that distinction because a lot of times when you go into physical therapy clinics, you need to look at the name tag that they have on them to make sure that they are who you think they might be. Just because they wear a white coat does not mean that they're a doctor. Just because it says physical therapy across their name tag does not mean that they are a physical therapist or a physical therapist assistant. And so that's why I'm making the distinction. So 7,500 physical therapist assistants in Texas. Texas is actually the largest employer of physical therapist assistants, but we only have 32 PTAs per 100,000 people in Texas. So actually, even though we might be the biggest employer, we have a much greater population that needs physical therapist assistance to be working in Texas. In fact, there are 17 states in the country that have more physical salary is pretty good. The median salary, the most frequent one, is $52,000 a year. And of course, that varies depending upon a lot of things. So physical therapy as a profession is predominantly female. And as a result of that, women tend to take time off from work to raise kids and family and or work part-time. And so that does affect the median income. And look at that. $27 different kinds of the profession is predominantly female. It's also predominantly Anglo. Our profession, along with many other health professions, have been working really hard to increase the number and the diversity, the cultural diversity of its association members. And so there is a pretty large Hispanic population of therapists, 8%. You might not think that's very big, but it actually is big, but it does need to be much bigger as our population distribution keeps changing. When you take a look at the Texas workforce requirements for there's this increasing need for them as a result of the aging of America. The baby boomers are coming into their retirement age. Excuse me. And then but it's not only the baby boomers. Physical therapy as a profession works with all age groups, from babies all the way up to persons who are getting ready to pass on. And we work in a variety of settings, like I mentioned. So the opportunities for creative jobs is incredible. You can work with kids in the school setting. You can work with kids in a pediatric clinic. You can work with athletes. You can work with athletes in a regular ISD type of setting. You can work with athletes as part of a private practice physical therapy clinic who sees kids who have had soccer and or football injuries. There are so many different kinds of injuries that affect the body physically that filter down to the physical therapist assistant team. We are the only profession in which there is a huge physical component to working with people. So having the qualities of good communication skills, liking to be touched, open to touching other people, those are really important physical characteristics of people within my profession, because we have to help people get out of bed. We have to help people to learn how to walk again, to learn how to run, to learn how to jump again. We have to help them compassionately through all the various levels of pain that they have and encourage them to work through that pain so that they can go back to doing what it is that they did before they were injured. But injury isn't the only area that we work with. We see lots of patients with neurological problems. These problems express themselves as balance problems or difficulty walking, but it's not due to a physical injury like a broken leg or knee replacement or a hip replacement. It's due to something that's not working right in the central nervous system, either the brain or the spinal cord. As I talk to you, you can see that our profession is heavily based in science, particularly in anatomy and physiology. We work with the entire system of the body. Granted, the musculoskeletal and the neuromusculoskeletal systems are the three most important systems. But we also work with the cardiovascular system, with the respiratory system, because patients get out of breath when they walk. Patients' blood pressure goes up because we're asking them to walk when they're in pain. Patients that have been in bed for a long time They get dizzy when they come to sit on the edge of the bed. And so all of the systems of the body are really important for physical therapy. Our Physical Therapy Association has lots of public information as well, and if you are interested in learning more about physical therapy and what it has to offer you as the public, choosept.com is the place to go. There you can find a therapist. There you can learn more about different disabilities or disorders that you might have and what kind of therapy you might need. You can find a therapist that can help you with those problems. And so at this point, I think I've pretty much covered the topics I thought might be important, but I would be open to hearing your questions.
Would you like me to show the program page?
Yes, because there may be some questions about that. So for you, those of you that might be thinking about coming into the program or know somebody that might be interested, there is a specialized admissions procedure, and there are 5 courses that are required to take prior to engaging in the specialized admissions process. Anatomy and Physiology 1 and 2 are 2 of those. Medical Terminology is another one. Introduction to Physical Therapy is a 4th one, and then we have an ethics and some other cores like English and normal development or lifespan within development. Some of those prerequisite courses require a B or better to get into the program, and all of the Gen Ed is at a minimum a C to get into the program. Our requirements for a GPA are 3.0, and we do have TSI 2 scores that are a little bit higher than the college's entrance requirements. So somebody in the chat had mentioned UTSB. No, it's UTMB in Galveston. That's the college that we have a bridge with. The program information guide that is up on our website has lots of information about how to get into the program. It mentions our counselors, Martha Brown and Priscilla Tomei, as being our main counselors for the program. Are there any questions that the audience might have?
Could you talk about what you do after you graduate for the certification?
Yes. After graduation, there is a licensing exam that every student has to take. Our capstone course, which is one of the final courses in the last semester, preps them for that. And there are multiple mocks that they have to meet specific benchmarks for to even pass that course before they can even graduate. So once they do graduate, the licensing exam is a requirement in order to practice in every state in the country. Like most health occupations and other medical professions, these exams are costly, and so we do our best to help our students pass that on the first exam. Our exams cost about $600 each time. Hopefully our students have to only take it once. We have a 90% first-time pass rate on our licensing exams, and we're approaching almost 100% for ultimate pass rates on our licensing exams. Once the student graduate becomes a licensed therapist, they can work wherever they want to. You get licensed in one state, but you can apply for licensure in other states, and recently there has been a compact being created across the country to work in another state that's part of the contract, for example, Colorado, then you only have to pay a small fee to then be licensed in that state as well. And that really has come as a result of COVID and all of the telemedicine that has been approved, making multiple state licensure a real possibility. Traveling physical therapy is one thing that I hadn't mentioned, and a lot of therapists do this. You work for a company and they send you all over the country to work for the 10 weeks or 12 weeks. And at each one of these facilities, you get to learn all sorts of new stuff that maybe you didn't actually get to learn in school, because school can only teach so much.
And here in El Paso, how is the job market for this? You said Texas has quite a few, so it's pretty.
Well, I mean, I've had 100% pass rate, 100% employment rate forever. I mean, ever since I started the program. So there's never a problem finding jobs, even with COVID. There was not a problem with my students finding jobs, finding the job that they wanted. I mean, their first pick, their first place where they would work, they might not have gotten, but they all are fully employed, working somewhere. A lot of my students choose to work in home health because that is a higher paying work setting. And now with COVID, my anticipation is that that area, which was hit hard by COVID because clearly the agencies, the home health care agencies, didn't have the personal protective equipment that they needed for their therapists. But now that that has kind of resolved itself, that work environment is going to be increasing as COVID survivors have multiple comorbidities that appear as a result of COVID. You know, I don't know if that you've been reading and listening to the news, but some of the side effects of COVID include continued respiratory endurance problems, which means labored breathing whenever you want to do anything. There's a lot of fatigue that happens with COVID survivors. There is weaknesses, and so physical therapy is one of the big professions that provides services to the COVID survivors to be able to get back to their life, both physically and with enough cardiopulmonary endurance to be able to enjoy life again.
Thank you. Thank you. And Mr. Castro has a question also.
I used to work as an aquatherapist for a physician by the name of Dr. Biganowski. So I saw how difficult but also rewarding it was for the physical therapist assistants, including the physical therapist. They would do hot and cold treatments. We had acupuncture. We had holistic medicine. It was great. So to be with these patients in the water to help them, you know, after a traumatic motor vehicle accident or, you know, some sort of spine adhesion that they would have, and it was really unique stuff. So definitely a field that I feel is much respected, absolutely. And to add on to the COVID, you know, these locations as well, if they're not added to the CARES Act, you know, you're getting your pay, but right now the government has so much money for that CARES Act. So if you have COVID and you're doing these or charging for these procedures, with the CARES Act, you're getting paid at 100%. So something to consider for those who have their own practice and you're not with the CARES Act. Please get registered as quickly as possible and start getting that funding back. There's a lot of money out there for you.
Right. I didn't emphasize so much of all of the different machines that physical therapy uses, because you're right. There are many, many machines that we can use. But traditionally, physical therapy is a very manual skill. It's our hands. It's our ability to mold your body like a piece of clay so that you can go back to walking normally, to being able to stand Aquatherapy is a medium in which physical therapy does, which the physical therapist or the physical therapist assistant performs the physical therapy interventions. Yes.
Thank you. And so if someone is interested in this program, what do you recommend that they do? What should they do to get more information?
Well, anybody that sends an inquiry to me, I usually forward directly to either Martha Brown or Priscilla Tomei, because those counselors can really help students who are interested in starting to take the right courses in the right sequence so that they don't waste time, waste money, and can graduate on time. But for people that are interested in the diversity of the profession and what are the possibilities, I would highly recommend that they go to the choosept.com website, where there's tons of videos that talk to you about all of the different avenues that physical therapy offers. This particular profession is a lifelong career, and if you get bored in one work setting, you can move to a different work setting and just keep moving to a variety of different work settings and not necessarily doing the same thing that you did at the last work environment that you worked at. There is so much creativity that is there. So thanks for putting that website back up. That's why I had started with that picture. And another place to go to learn more about our profession is the American Physical Therapy Association. You just type in apta.org, and that takes you directly there, where you'll find more information. So the advocacy area is one place where the public typically tends to go, and your career is another place where the public tends to go if they want to find out more about the actual career of physical therapy for the physical therapist assistant or the physical therapist. And of course, I mean, you can always contact me. I get emails all the time. My email address is on the program guide that is on the program's website. Or you can just type in physical therapy on the college's website and it will get to my website.
I'm sharing that screen right now so we can get your contact information. There you are.
I wish that was me. I no longer look that young.
And there's your contact information down at the bottom.
Yes.
And then also Ms. Brown is the counselor, and we shared her information earlier as well, so you can contact her as well to get some information about how to get into this program. Are there any questions? Thank you so much, Dr. Bright. This was a great presentation to learn more about that program, so we really appreciate that. We look forward to hearing more in the future as well. So thank you so much for being here, and to Mr. Castro also for being here and sharing about his programs. And thank you to everyone for coming today. We really appreciate you taking the time to come in and learn more about our great programs here at EPCC. I have put a survey and a link to get your Tejano passport points. There won't be any workshops next week because we are closed for holidays on Wednesday and Friday when we usually have our Tejano virtual events. But we'll be back the following week. On Friday, we'll be talking about criminal justice and psychology programs at EPCC, so we hope you can join us then. So I hope you all have a great day and a great weekend. So thank you all.
Thank you. Bye-bye.